Good morning, Christine. So this gene that she has is what's called the BRCA gene, or a breast cancer gene. And women usually get tested when they're in her situation, which is that they have a close relative or relatives with not just breast cancer, but also, or instead of ovarian cancer, one or the other, or sometimes both. And so what she did is really smart. She knew her family history and she got herself tested. And when you get tested, they might say, guess what? You're good. You don't have any mutations. Or in her case, there were mutations. So let's read a little part of her New York Times article that talks about what was found in her case. She said, I carry a faulty gene, BRCA1, which sharply increases my risk of developing breast cancer and ovarian cancer. My doctors estimated that I had an 87% risk of breast cancer and a 50% risk of ovarian cancer, although the risk is different in the case of each woman. So, those numbers are high. Imagine being told, Christine, that you have an 87% chance of getting breast cancer. You can do different things. Some women say, I'm going to get a lot of mammograms and MRIs and just really keep my eye on this. Other women take drugs to prevent it, and other women do what she did, which is to get both their breasts removed.
And first, women who I know have gone through this cry, because this is really a scary thing to go through. Some women decide not to have preventive surgery. Others decide that they're going to monitor it, and others decide that they're going to do it, or they're going to first do mastectomy and then remove the ovaries. The first step, though, is getting screened for this gene. How do women go about getting screened for cancer?
What's interesting about this is that doctors themselves often tell me, you can go to a doctor, but really you're better off with a genetic counselor, because genetic counselors are steeped in this, and this is really complex. I can't emphasize enough, this is not simple, and so you want someone to counsel you through it. So if you can find a genetic counselor, go to one. If you can't, and sometimes they're hard to find in some cities, go to your doctor, talk about the testing, and talk about what it means, and be prepared for news that you don't want to hear, and be prepared for tough choices. What we've seen here is that she decided to have her breasts removed, and in the article it sounds like it's possible that she's going to go on to have her ovaries removed, which is recommended in this situation, that women have their ovaries removed, before the age of 40. A genetic counselor was telling me that. She tells her patients, get your ovaries removed before your 40th birthday.
And Angelina Jolie, she's 37 years old? 36
That's right.
or 37
That's
years
right,
old?
37, right.